Okay, so for this tutorial, we are going to talk about setting up NIV for a patient on a Hamilton G5 ventilator that we have here. Now, this can also apply to the Hamilton MR1, T1, and our C6 platforms here at our facility. So, let's look at the screen here. So, Hamilton vents, they will default to ASV mode. So, let's go into modes and look at our non-invasive modes. So the Hamilton has two non-invasive modes that we have that are configured for this ventilator. So we have NIV, which is non-invasive ventilation, and we have NIV ST, which is non-invasive ventilation spontaneous time. So these are the two modes that you are going to utilize for non-invasive ventilation for your patient. So let's look at NIV. So we'll select NIV, continue, and now we're going to look at our control panel here. So here we have our pressure support setting, which is our delta P. We have our CPAP setting. We have our FiO2, flow trigger, our expiratory sensitivity setting, ramp, and our I time max. Now also on NIV, you do not have a backup respiratory rate. You have a backup ventilation mode. So should your patient go apneic while receiving NIV therapy, they will go into this backup ventilation mode, which you can see here it's set for a rate of 15, a pressure control of 15, and an I time of 1.3. You can adjust that accordingly. So if the patient is in this mode, that patient's going to receive 5 of pressure support, 10 of CPAP, and 50% FiO2. Should they go apneic, they will be placed in the backup mode, which is pressure control. And once the patient begins to initiate breaths, the backup mode of ventilation will cease and it will revert back to NIV mode. So here you have a backup ventilation mode. If we go to NIV ST, you can actually set your backup rate, very similar to how we set up our V60s. So let's go ahead and confirm here. So right here on the top indicates you are in NIV, and then your NIV settings here. So we will remove the elbow by just pinching it and pulling. You will then grab the blue elbow that we keep in our equipment area, and you will attach the elbow to the front end of the mask by just clicking it in place. So now your mask is ready to be set up on the Hamilton vent. So you will connect the mask directly to the circuit right on the flow sensor. And now it is ready to be placed on the patient. So when you're ready to place it on the patient, you will hit the start button. So as you can see, your screen looks very similar to what you're going to see in an invasive mode. It looks exactly the same. So here you can see all of your data. You can see your exhale tidal volume, your peak pressures, respiratory rate, and see how many breaths that the patient is actually triggered. So let's go ahead and place it back in standby here. I just had the mask held up to my hand just to give you guys a little bit of a waveform here to see. Okay, so let's talk about NIV ST. So we'll go back to modes and select the NIV ST. Continue. Now a little bit different screen here. So you notice you do not have a backup ventilation mode. Instead, your patient has a backup respiratory rate. So that respiratory rate right now is set to 12, still 5 of pressure support, 10 of PEEP or CPAP, and then 50% FiO2. You still have your flow trigger, you have an inspiratory time, and you have your expiratory sensitivity, your I time max, and your ramp. So if I want to place a patient on just CPAP, then I would not need that pressure support delivered at all. If I just want to give my patient CPAP, I would turn my pressure support down to 0, so that way the patient is only receiving 10 of CPAP. If the patient begins to exhibit signs of difficulty taking in volumes or a little bit of respiratory distress, then we can go ahead and increase that pressure support as needed for that patient to be able to get those volumes in. So now I've added 5 of pressure support. So if I were to translate these settings to a V60, I would expect the settings on the V60 to look like 15 of IPAP, over 10 of EPAP. So that would give me 5 of pressure support. So that is how those settings translate. So you're not going to set these settings like you're going to set it on AV60. Just keep it in mind. I know some people get a little confused and think that this is your IPAP setting, and it is not. It is your pressure support setting. So it would not be appropriate for you to set your patient up on 20 pressure support over 10. So just keep that in mind, that you are setting your delta P here. And you just increase it as needed for that patient. So we're going to hit confirm. And then if your patient gets re-intubated, it's very quick change back to an invasive mode, whether it be APV, CMV, ASV, pressure control. You can switch back to those modes very easily. You can go to APV, CMV, you hit confirm, and then now you're in APV, CMV. So very simple switch back and forth, and then you can remove the mask and then get it ready to set up on the patient with an ET tube or tray, whichever airway that they have. So that is just a quick overview of setting up NIV on a G5. So I hope this was helpful. And if you have any questions, please leave comments, or you can email me if you have any questions about this presentation.